Hello, I'm Dr. Aruna Muralidhar, a consultant obstetrician and gynecologist with 20 years of experience in the field. I practice in Bangalore. So let's see what women have been searching for on Google. So the first question is, there we are. Okay, does birth control pill cause problems in pregnancy later? Certainly not. Birth control pills contain estrogen and progesterone, and they basically avoid ovulation from happening, and they're only effective as long as they're being used. Once they're stopped, the fertility is reversed back again, and the lady is fertile again, and they do not cause any trouble in future pregnancies either. Go on to the next question, which is, how long can sperm live in the reproductive tract? Now, this is a very variable phenomenon. It can depend on several factors, including the time of the ejaculation, how long the ejaculation has been since last time, and also it depends on the vaginal pH, that is the pH of the vagina. But in general, the sperms stay for up to 3 days, and it can be very variable. So it does depend on a lot of factors. We would then go on to the next question, which is, there we are. Are there certain days in my cycle that I can't get pregnant? Alright, so essentially, if a woman is having regular periods, that is about 28 to 30 days apart, the first week after the period is generally the time when she's had a period and the lining of the womb comes out completely. For two reasons, the pregnancy will not happen during this time. One is there is no egg to fertilize, and the second, there is no lining to, for the egg to implant in. Similarly, the last week of the period is the time when it is less likely for a woman to get pregnant. It's usually about 14 days before the period that the woman is ovulating, and the highest chances of falling pregnant would be in the second and the third week of a cycle of 28 days. But again, it is very variable depending on the lady's cycle length. We will then go on to the fourth question, which is what people are searching for on the internet. Is there one best kind of birth control? I think the one best kind of birth control is actually removal of the uterus. But jokes apart, there are various contraceptive options. The best option is sterilization, which of course is permanent. Then come, according to the efficacy of contraception, come implants, intrauterine devices, which either contain copper or hormone, contraceptive pills or birth control pills, the injections, the injectables, and of course after that come condoms. So condoms do have a very high failure rate. Right, now we go on to the fifth question, which is it true that you can't get pregnant if pills are used for a long time? No, as I said earlier, as long as the pills are being used, there is definitely very less chance of falling pregnant. But once the pills are stopped, the fertility returns back to normal. In some women, there may be something called a post-pill amenorrhea, where there is no period for a long time, but that happens very infrequently. So yes, the fertility does return back to normal once the pill is discontinued. Now coming to the sixth question, which is, what age can I stop using contraception and be sure not to get pregnant? Very good question indeed. So essentially in India, women undergo menopause anywhere between 48 to 50 years of age. And menopause means 1 whole year of not having a period. So once the woman has not had a period for 1 whole year during that age, it means she's not ovulating anymore and the ovaries have stopped to function. And that is a time when she can safely stop using the contraceptives. But all the years prior to that, there's always a chance of pregnancy, an unexpected pregnancy. Hence, the woman should continue to use contraception until she reaches menopause completely. And now coming to the final question. Okay, there we are. Right. Can I take the morning after pill at night? Yes. Yes, obviously yes. This called a morning after pill. It's also called the emergency contraception pill. And the faster it is taken after unprotected sexual intercourse, the better the effect. Ideally, it should be taken as soon as possible, so it doesn't necessarily have to be the morning after. It depends on when the sex was. If the sex was in the afternoon, you could take it around a few hours after that in the evening as well. The point is that it should be taken within the first 72 hours, and that works to a certain extent in preventing an unwanted pregnancy. Thank you very much for watching. If you like this video, please share it amongst your friends, and do leave your comments on Ask Tanu. Thank you very much.